Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what anxiety and depression are, symptoms of anxiety and depression, how does anxiety and depression affect epilepsy, the effect of anxiety and depression on the quality of life, pathophysiology of anxiety and depression, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to Medline Plus, anxiety is a feeling of fear, dread, and uneasiness. Anxiety disorders are conditions in which anxiety does not go away and can get worse over time. Anxiety can impair someone's life. According to the American Psychiatric Association, depression is a common and serious medical illness that negatively affects how you feel, the way you think, and act. Depression causes feelings of sadness and/or a loss of interest in activities once enjoyed. Depression can cause emotional and mental problems and impair the ability to function. People who have epilepsy, around 9 to 37% suffer from depression and 11 to 25% suffer from anxiety. According to Mayo Clinic, symptoms of anxiety are feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly or hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety. According to Mayo Clinic, symptoms of depression are feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability or frustration, even over small matters, loss of interest or pleasure in more or all normal activities such as sex, hobbies, or sports, sleep disturbances including insomnia or sleeping too much, tiredness and lack of energy, so even small tasks take extra effort, reduced appetite and weight loss or increased cravings for food and weight gain, anxiety, agitation or restlessness, slow thinking, speaking, or body movements, feelings of worthlessness or guilt, fixating on past failures or self-blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts or suicide, and unexplained physical problems such as back pain or headaches. People with epilepsy commonly have panic disorder, generalized anxiety disorder, or seizure-induced fear. Panic disorder results in people having panic attacks and anticipatory fear of them that affects daily functioning. Generalized anxiety disorder causes excessive worry and anxiety combined with restlessness, lack of concentration, irregular sleep patterns, fatigue, irritability, and muscle tension. The majority of people with epilepsy and anxiety experience generalized anxiety disorder. It is hypothesized that the onset of anxiety in epilepsy is due to the lack of control and erratic nature of seizures. Depression in epilepsy most often presents as interictal or between seizures. Symptoms can be due to lack of enjoyment, low energy, reduced appetite, abnormal sleep patterns, and agitation. More severe symptoms include psychosis or impulsive self-harm. Preictal depression may appear before a seizure. If this pattern occurs, a short-acting benzodiazepine can be used to prevent seizures. Ictal or while seizing depression is extremely rare, while ictal anxiety is more common. Anxiety and depression can decrease the quality of life for people battling epilepsy. Comorbid depression and epilepsy can have catastrophic effects on the body. Failing to treat can lead to suicide. Negative effects of epileptic medications and seizure frequency can increase if sleep deprivation is also present. Individuals battling epilepsy, 25 to 49 years of age, have coexisting psychological or personality disorders, have temporal lobe epilepsy, uncontrolled seizures, prolonged epilepsy, and personal, professional, or social difficulties are more at risk for suicide. Around 80 to 90% of suicide attempts are overdoses. If you are having thoughts of suicide, please contact the National Suicide Hotline at 1-800-273-8255 for help. Anticonvulsant medication creates a higher risk of people with epilepsy experiencing depression. Medications such as vigabatrin, phenobarbital, and topiramate are most commonly associated with acute depression. If you are experiencing any negative side effects with your medication, consult with your doctor before making any changes to your treatment plan. Anti-anxiety and antidepressant medication is an option for patients who are battling severe cases. Seeing a therapist and making lifestyle changes can help to reduce symptoms of anxiety and depression. Studies are being conducted to use vagus nerve stimulation to help treat drug-resistant depression. Anxiety is a feeling of fear, dread, and uneasiness. Anxiety disorders are conditions in which anxiety does not go away and can get worse over time. Anxiety can impair someone's life. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and act. Depression causes feelings of sadness and/or a loss of interest in activities once enjoyed. Depression can cause emotional and mental problems and impair the ability to function. There are many symptoms when it comes to anxiety and depression, and if not properly treated, can greatly decrease the quality of life and increase the risk of suicide. Different treatment options are available. If you are experiencing anxiety and depression, talk to your physician to see what options are available to help. To learn more about anxiety, depression, and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.